what's going on behind the scenes when you check into the ER. Part one. At first, when you check in, you're usually going to hand your ID to the front desk where registration staff are going to get your name, date of birth linked with an existing record in the computer system, or they're going to create a new record for you. They're going to pull you into the room. They're going to ask you questions about what brings you into the ER today. Usually things like what type of pain are you having or what problem are you having, how long it's been going on for, and then they're going to go into some of your medical history and verify that, the medications you're taking, allergies, and other certain risk factor questions that they have to ask. Along with this, you might be greeted in the triage room by an NP, an PA, or an ER physician who are going to ask you some further questions to get some initial tests started. Nurses can also order these initial tests based on certain presenting complaints like chest pain or abdominal pain or headache. Usually, after this, you're going to go back out into the waiting room and you're going to take a seat. Even though you might be thinking there's nothing going on, I'm just sitting in a seat. Usually, our phlebotomists find that your order for your blood work is on the list and they're going to come grab you for blood work. Or if you have any imaging ordered, x ray or CAT scan may come grab you as well. So, even though you're sitting in the waiting room, a lot of stuff is going on in the background. And more often than not, sometimes your entire visit can be taken care of in the lobby and you can be discharged from there just as you would from a bed. Who gets a bed? Well, there's a lot of things that vary on that. Not only do we have people checking in the front door, but we also have a lot of medics coming in the back. And a lot of those medic runs, some end up going to triage, but most of those end up going to a bed. Usually, beds are assigned by acuity. It's not necessarily length of stay, it's acuity. Usually, from there, we will go to length of stay as a next line to sort who needs to get into a bed. And there's also some provider discretion on this, on what should be in a bed and what should not be in a bed. So there's a lot of factors that go into whether or not you'll be sitting in a chair for a long time throughout your ER visit or you'll get a bed faster. Just because you're sitting in the lobby does not mean things are not getting done. A lot of times things are being ordered, tests are being read, things are being taken care of to make sure that you have a safe and speedy ER visit and you can have a safe disposition, whether that be admission, discharge, or going home. Make sure you follow along for part two as we cover what starts to happen when you get back to a room.